What's up, and thanks for stopping by. Because today is just real random. I came across something on my phone. I'm just looking at my phone, and you know how you'll get the random advertisements or little news things that pop up on your screen. So I'm looking at my phone, and I just see this thing that the title catches my eye, and it says, drug-resistant superbug confirmed in Maryland. So what caught my eye pretty much was the Maryland, because I just moved from there not too long ago. So I was like, drug-resistant superbug. What? Superbug? And we not... So I was like, man, I'm going to read this. Now listen to this. So this is how it starts off. I don't even know how to pronounce what this is called, but I'm going to do the best I can do, and I'm going to spell out the word so you can look it up for yourself. So it says, a powerful drug-resistant superbug, Candida, C-A-N-D-I-D-A, Candida. And the next word is A-U-R-I-S, Aris, whatever, has been reported in 12 U.S. states, including Maryland. The sometimes fatal fungal infection is a serious global health threat that has hospitalized patients in several countries, including the United States, according to the Centers for Disease Control and Prevention. That's the CDC, you guys. It's gotta be real. So, and then, I'm like, are you serious? A superbug, a drug resistant, you can't kill it? What? And so then it says the hardy fungus can remain colonized in patients and on services in healthcare facilities for long periods of time, making it more difficult to fight, the CDC says. So you mean this stuff can hang around in the hospital where you're supposed to get rid of this stuff, and it's hanging around waiting to get more people? All right, this is a superbug hanging out in the hospital. And so in Maryland, 3 cases have been confirmed. Other states confirmed. Now, if y'all are out there, have y'all heard this? In California, Connecticut, Florida, Indiana, Massachusetts, Oklahoma, Texas, and Virginia. So together, U.S. states have reported 613 confirmed cases with an additional 30 probable cases. They probable? Y'all ain't figured it out yet? Are you serious? That chicken is popping. I'm roasting that chicken in the oven, and the juices are bubbling. So, has anybody, if you're listening to this and you're in that state, have you heard anything about this superbug that cannot be killed? And it just goes on, and as you're reading, it's crazy. And then it's large outbreaks have been reported in New York City, Chicago, and New Jersey, which have seen 319, 156, and 106 confirmed cases, respectively, as of March 31st, 2019. What? And then it says the CDC said a patient who received health care in a country where the fungus has been reported brought it to the United States. So how y'all know which country it came from? How you know which country? That don't make no sense to me. But and it just makes you just keep reading. And then it was even put, Senate Minority Leader Chuck Schumer, a New York diplomat, has asked federal health officials to declare an emergency to help fight the spread of the superbug. It's an emergency. We need a superhero. And it says, we are here today to urge the CDC, the Center for Disease Control, to deliver a whole bunch of resources that can help New York and other states kill this bug and stop its spread, Schumer said during a Sunday press conference. He said that? Did he he called for an emergency declaration to free up money in the federal budget to help identify the threat and diagnosis of this. What? And I have not heard of no superbug, but we is spending money. The government is spending money on this. And then what else? It was this. To free up money for the federal budget to help identify the threat and diagnosis additional cases, tackle it through preventive efforts, such as education, and treat it without relying on antibiotics. Without relying on antibiotics. So we ain't gonna give y'all no medicine. We just gonna wish it away, you know? And then it says, Scrumer noted that a health emergency declaration several years ago unleashed. Now this says, I don't know if this editor put it in wrong, but it says 165 to fight the Ebola virus. Now it says, I don't even know if you can see it, but it don't have, it's a 165. There's no zeros behind that. There's no, it's that, what to me is $165 to fight the Ebola virus. I can't even feed my family in a month for $165, and you got rid of the Ebola. But so that's what I was like. So come on, this is not correct. It can't be correct. It can't be correct. I know, and it's just, and then it says, I mean, the CDC, come on. And then it says Canada grows a yeast, and symptoms include difficulty swallowing, burning genital itching, and sometimes a cheese-like discharge that looks white. That sounds like something you need to see your physician for, but you can get a pill to take it away. I mean, and this is for reals. And then it says that this, then they break it down, and then they say it was first detected in 2009 in a patient in Japan, and there is documented transmission of. They break it down. They just put a C, period, AURISRs, to U.S. patients from healthcare facilities in India, Pakistan, South Africa, and Venezuela, according to the CDC. Who in the CDC said that? Who said it? But I mean, they said based on information from a limited number of patients, the CDC said 30% to 60% of people with C. auris infections have died. However, many of these people had other serious illnesses that increased their risk of death. So they're saying this, it wasn't really that, the Canada. It was these people was already. And let me tell you, there was something else. Oh, and then this part with some money transfer said, indeed the disease had prevented itself as enough of a threat to the CDC, awarded Rutgers University a $300,000 contract over 2 years to fight the infection spread as part of a CDC's antibiotic resistant solutions initiative. But it only took y'all $165 to get rid of the Ebola. I don't know. I might be reading there, but I don't know. You know, this superbug. Oh. And then it's acting like a superbug. Paige Armstrong, CDC Epidemic Intelligence Service Officer, has said. Without appropriate infection control and really a rigorous response, it could lead to even more cases in the United States. Get that ish out of here! Get that superbug gone! Superman! You done let your bugs out! I don't know. But that is some crazy mess to me. And then, if you want to know how you can get rid of ways to avoid contracting the disease, one of the best ways to prevent spread of dangerous germs like C. auris See, I'm not lying. They done broke it down. If you can see it. That first one. Boom. Is healthcare in healthcare settings is good hand hygiene. Washing hands frequently can help prevent its spread. Early and accurate identification, rigorous infection and control practices, and communication between facilities are key to reducing the spread in healthcare settings. And proper infection control involves consistent hand washing, use of personal protective equipment, and hand hygiene, washing hands frequently to prevent its spread. Like, this sound like this is what y'all already just said. Y'all keep saying the same thing. Wash your hands. Wash your hands. Be clean. But I'm just saying that, you know, it came from Patch, national writer Tom Davis in New Jersey contributed reporting. But then it says somebody else. But I ain't gonna, you know, whatever. A Patch. But yeah, it's a superbug. Anybody in them states heard of this superbug? Because I didn't hear nothing of it. I thought, you need to let me know if a bug that cannot be killed. You ain't, what? I guess you don't want to panic nobody. But that was just my real random, and I wanted to say, you know, fake news. That makes you make sure you read through every line. Whatever you read, and just read every line, because something might not seem right. But hope everyone is having a wonderful day. Hope you enjoyed my video. Share any thoughts, comments if you like. And I'm out.